most famous physical therapist on the internet.
Hi, folks.
We're
I'm Bob
ready.
Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course,
I got
Bob.
to keep you on task, Brad. Today we're going to talk about tight piriformis syndrome, pinched nerve relief. We're going to show you 5 at-home treatments to fix.
That's right, Bob. 1 through 5. They may not all work for you, but for certain, you're going to find at least 50%.
Find out which one does and stick with that one. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, what's the giveaway, Mike? Is it the mattress?
Oh.
If you get a chance, go to bobandbrad.com, go to the giveaway section, because we are giving away a freaking mattress.
Oh, Bob, it's a family show, remember. But they are
fantastic mattress.
They are a beautiful high-end.
Sleepovation mattress. Also, a couple pillows.
Oh, good.
You'll find it on Facebook. Also, it'll be pinned to the top of the page to give away. Go to Twitter, Instagram, or TikTok if you're looking for a 60-second version of Bob and Brad a day.
Piriformis syndrome, Bob. What are we talking about? They're talking about a problem that starts in the buttocks, and that's where the piriformis muscle is. That's how it gets its name. It also has pain in the butt, and oftentimes similar to sciatica or our sciatica symptoms, pain, numbness, tingling can go down your leg all the way to your foot from the piriformis muscle.
And this last little over a week, we did a video on how to diagnose it. I mean, 3 signs of it.
Right.
Not really how to diagnose it, but possibly that you have it.
Right, exactly. So this is kind of a follow-up, and that's what we said on that video.
Right, you were going to show where the piriformis is?
Yeah.
It's going to be important for doing the treatments today to know where it's at.
Yep, it really does help to get that down pat. If you look at the skeleton of Sam here, he's been real cooperative this week. We've got the green represents where the piriformis muscle is. Now, remember, the piriformis muscle is kind of a small muscle. It just works with the hip, and it goes right across this area. And if you look at this yellow tubing we have here, that actually represents the sciatic nerve.
Right.
That's the nerve that we're talking about being pinched. When that muscle tightens up, it can pinch the muscle, and anything distal or down the leg can create those pain, numbness, tingling symptoms, and also pain in the buttocks itself. What do you say?
No, I'm just saying, I'm looking for the sciatic notch because it needs to go through the sciatic notch.
Well,
nerve.
yeah, it's underneath the muscle.
Yeah, okay,
Well,
got it. Okay.
Yeah, he's getting technical
Yeah,
now.
there, I just moved the nerve out of the way now.
There we go. That one won't get pinched.
Yeah.
Okay.
All right, let's get started with the treatment, Brad.
All right.
So,
one thing I did want to mention, that nerve is actually kind of buried underneath the gluteus maximus muscle, as well as a little bit of the...
Yeah, so it's deep.
Yeah, it's deep, and and that's going to come up in just a little bit. That information will be helpful.
Yeah, glute max, that's got to be the biggest muscle in the body, right? I mean,
typically it is.
One of the strongest muscles.
It may vary from person to person, but it's right up in there. So if you do want... Now, we talked about the muscle being tight, and it can actually... what's that term we use for tight muscles, Bob?
Contracture? What are you looking for?
It'll come. Anyways, we get a tight muscle, a knot. It's like a knot in that muscle. We need to loosen that up. Oftentimes, people say heat. Maybe heat's going to help, which is true. But remember, the piriformis is a deep muscle. So if you want to heat the piriformis muscle, you're going to have to go something deep. You can do it with ultrasound, but typically that's only found in the therapy or a chiropractic office.
Right.
Or you can go to far infrared heat, which you can buy and
purchase on your own.
You can purchase on your own, and we do have that if you want to do that option. We've been using this for years, personally as well as with patients. It's the Thermatex Far Infrared.
Yep, heating system, and normal heat will just penetrate a few centimeters.
Skin deep.
Not a few centimeters, few millimeters.
Right.
Yeah. Where this will actually penetrate 2.36
inches.
2.36 inches. Think about that. How much more deeper that is. That's why Brad and I like to use it on our back all the time.
Right.
So
as far as the piriformis, this will get down.
Right.
It's going to get much deeper, much more chance of success. You'll need to, be on it for 30 to 45 minutes. It's very comfortable, very well built.
You wouldn't have to sit on. You could lie on your good side
Sure.
and just drape it over there.
Yep.
And it would work out real well.
Exactly.
We'll put a link below. We actually get a significant discount if you use our link.
Right. Exactly.
These are pricey. I'm
Yep.
going to warn you, but they're worth it.
Right.
Okay, let's move
So
on, Brad.
then you're gonna, if you do have this option, you're gonna heat it first, then go on to these next options. You'll just have better success with a warm muscle. It's got better circulation,
Sure.
etc. This next one is very simple. It's the stretch.
Yeah.
We call it in the therapy world. We call it the FAIR, FAIR.
Sure.
You wanna do it?
No, you go ahead, Brad.
Oh, okay. Yeah, it'll work better with the stripes. I
Right,
think.
that's what I was
So
thinking.
you lay down. You can do this on your bed, on the floor, whatever you're comfortable with. And let's say Piriformis right here. That's the one that's acting up. I'm going to bring the knee up, grab it here, and kind of pull it over towards the opposite shoulder. And that's going to put a stretch. Now, don't get too aggressive on this, particularly if it's in an acute phase and it's pretty sensitive. So you can hold and relax. If you want to do a sustained hold, you feel like you're getting better results, you can do that up to 30 seconds. I often have my patients do the hold and relax.
Yeah.
But either way,
Kind of pressure on, pressure off.
Exactly.
I quite often like.
do what works for you. The next one, take the other knee and go up like this. I call this the figure 4. And I do, because if you look at it from this angle,
It looks like a 4. Yeah.
exactly. At least it does to me. And then here, we can push like this. Now, do you do this one like this, Bob, or do you add a little tweak to it?
I usually, sometimes you can bring the other knee up.
Yeah.
That's usually what I do.
Yeah, there you go.
That's what I do.
And up like this. And this one, if you're a little older or if you have tight hips, those people may have a little challenge.
It may be tough to do that.
Right.
one.
So younger people, typically, it's
For
a piece
those,
of cake.
it might be enough just to put the foot up there. I mean, the ankle up there.
Sure,
I mean,
exactly.
It might be enough stretch already.
And the same thing, pressure on, pressure off, 5 to 10 repetitions as tolerated.
Again, see what works for you. If it gives you increased pain, we don't want to do it.
Yep, exactly.
You don't want to enter the pain cave like I saw in that one book.
Oh, the pain cave.
Yeah, stay out of the
Oh.
pain cave. You can look at the entrance of it, but don't go into it.
I've heard the pain box.
Oh, have
Oh,
you
no,
really?
the hurt box. Anyways,
Oh, the
that's
hurt box.
another story. 6-inch roller. Now, this is
I'll grab
something
that, Brad,
some
for you.
people, these are getting quite popular in the last few years. And it's for a good reason, because they work well. This is a short one. You can have the 3-foot long ones, whatever. 6-inch diameter is pretty common. This particular one is a bonus because it actually vibrates.
Right.
And that gets to that muscle even more aggressively. You don't have to have one that vibrates. You can just use a regular one. And then you're just going to work on it here. And you'll change the position as you'll feel. You'll feel when you get on that knot, that Piriformis knot that I was talking about
Yeah,
earlier.
again, you can take weight off the area by taking more weight on
Yep,
your arms or
yep.
legs. But
Yep.
I'm a big fan of the foam roller, the vibrating foam. I use it every morning. I use it on my hips, on the front of my hips.
Sure.
And it just seems to do a better job than a regular roller in my
Yeah.
mind.
It does. And this one's not too expensive.
No, it's not. They used to be. I mean, the one I have was given to us. It was like a $200 roller.
Yeah.
And it's the same as this one, which is, I don't remember. Do you remember?
Around 40. Yeah, it's a bargain.
So,
Yeah. Yeah, they're a wonderful product. And let's go on. You don't have to have a foam roller.
yeah, you don't have the foam roller. If you want to, you can just use
the old tennis ball. Now, this is a little more aggressive because it's more pressure on a smaller area. You're not going to be able to do this. Bob, you just walk in front of me.
I know.
He doesn't care.
I know.
I have no respect.
I know.
Another Rodney Dangerfield. So do not do this on a mattress. It won't work. It'll squish in too far. You
Right.
need to go on a carpeted floor. Is probably the best. I'm not going to jump down on the floor to
It's
do
going to
it.
be pretty aggressive.
Yeah.
You gotta really gonna have to
Yeah.
control it.
Oh, it is. Definitely. But you can certainly do this as long as you can control the force and weight with your arms and your legs.
What I have found, Brad, the thing that has helped most of my Piriformis patients has been some type of massage like that.
Sure.
Whether it's foam roller, whether it's tennis ball, whether it's like this is a Renfo massage.
Right,
This
because you're
is-
probably not going to get someone at home to give you a massage, but you can do this by yourself, or you can get someone at home to help you as well. Go ahead, Bob. Show it works.
Yeah. So this is the Renfrew massage gun. This one's actually an adjustable one, just kind of cool. So this head actually adjusts into 5 positions, I believe. Is it 5, Mike, or is it 6?
I think
It
it's
says
5.
on there. Doesn't say to me.
You used to know, Bob, but ever since you got almost 60 years old, you can't remember anything.
Yep, that's right. On the side.
Don't worry about it. 5 or 6, it doesn't matter.
Anyway, this thing does the work for you. You don't have to move around. I can get right into the area here. Brad, you look like you're disapproving.
I don't know what they're thinking, but it looks kind of weird. But whatever, it works. You know, if it does the job, it does the job.
The thing is, these massage guns, they really have a lot of translation. They really
I call
move
it
far.
travel. It travels
Okay.
back and forth. Yeah.
Yeah, you can see it really works the muscles, really gets deep
The
into
nice thing
it.
about this is you can use it on a lot of other muscle groups throughout the body. As a matter of fact, I was just doing my hamstring with it before the video.
I don't know if Mike's talking about the speed because it's got the speed on there, the 4 different speeds, but there's no on the side. Do you see on the side that there's an adjustment for the?
You can't see from there, Mike. You're not that
Yeah.
good. Doesn't say
he's-
how. Oh yeah.
Oh, there
Sure
are the
enough.
numbers.
Yep, 5.
Oh God, we got
He's
to.
right.
Mike's right
Yeah,
for once.
there you
There's
go.
5.
Well, we've bored these people enough,
Yeah.
Bob.
Thanks everybody for watching.